My name is Julio. I've been married to my wife, Jasmine, the last 27 years. We met 32 years ago. I like to run, I like the movies, and I also like to travel.
My name is Jasmine. Julio and I met in college during our first ever class of algebra in electronic engineering.
The initial bladder cancer symptoms that I have was blood in my urine. That happened after a half marathon I ran in January 2020. And I was alarmed. I went to the doctor to see what was the problem. And after a few tests, I was diagnosed with bladder cancer. After learning about my diagnosis, I was very concerned. It was unknown what was going to happen with it, and knowing that it was growing, I was very concerned. I was concerned about my own health and, of course, my family and the future of my family.
When we learned about Julio's bladder cancer diagnosis, it was a kind of a very desperate moment for us as a family.
After I learned that I had low-grade, intermediate risk, non-muscle invasive bladder cancer, the doctor at that time gave me just the option of having a surgery because I had a 2.5 centimeter tumor inside my bladder that needed to be removed. So after experiencing my recurrence, I thought, oh, this is going to be something I will need to do every year.
We don't know what's going to happen if he was going to be having surgeries every year, every 6 months.
The way I learned about the clinical trial was after my second recurrence. I went to the doctor and the doctor offered me another treatment that was different than the traditional treatments. My experience during the clinical trial was very positive. I was explained all the differences between the clinical trial and other options available. And after finalizing treatment, I was able to work, travel, and spend time with my family. The advice I would give to other patients seeking treatment is to talk to their doctors and examine carefully all the options available on the table for treatment.
Approved use for ZUSDURI. ZUSDURI, mitomycin, for intravesical solution, is a prescription medicine used to treat adults with the type of cancer of the lining of the bladder called low-grade intermediate risk non-muscle invasive bladder cancer, LGIR-NMIBC, after you have previously received bladder surgery to remove tumor and it did not work or is no longer working. Important safety information. You should not receive ZUSDURI if you have a hole or tear, perforation, of your bladder, or if you have had an allergic reaction to mitomycin or to any of the ingredients in ZUSDURI. Before receiving ZUSDURI, tell your healthcare provider about all of your medical conditions, including if you have kidney problems, are pregnant or plan to become pregnant. ZUSDURI can harm your unborn baby. You should not become pregnant during treatment with ZUSDURI. Tell your healthcare provider right away if you become pregnant or think you may be pregnant during treatment with ZUSDURI. Females who are able to become pregnant. You should use effective birth control, contraception, during treatment with ZUSDURI and for 6 months after the last dose. Males being treated with ZUSDURI. You should use effective birth control, contraception during treatment with ZUSDURI and for 3 months after the last dose. Are breastfeeding or plan to breastfeed. It is not known if ZUSDURI passes into your breast milk. Do not breastfeed during treatment with ZUSDURI and for 1 week after the last dose. How will I receive ZUSDURI? You will receive your ZUSDURI dose from your healthcare provider 1 time a week for 6 weeks into your bladder through a tube called a urinary catheter. It is important that you receive all 6 doses of ZUSDURI according to your healthcare provider's instructions. If you miss any appointments, call your healthcare provider as soon as possible to reschedule your appointment. During treatment with ZUSDURI, your healthcare provider may tell you to take additional medicines or change how you take your current medicines. After receiving ZUSDURI, ZUSDURI may cause your urine color to change to a violet to blue color. Avoid contact between your skin and urine for at least 24 hours. To urinate, males and females should sit on a toilet and flush the toilet several times after you use it. After going to the bathroom, wash your hands, your inner thighs, and genital area well with soap and water. Clothing that comes in contact with urine should be washed right away and washed separately from other clothing. The most common side effects of ZUSDURI include increased blood creatinine levels, increased blood potassium levels, trouble with urination, decreased red blood cell counts, increase in certain blood-liver tests, increased or decreased white blood cell counts, urinary tract infection, blood in your urine. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. You may also report side effects to Urogen Pharma at 1-855-987-6436. Please see ZUSDURI full prescribing information, including the patient information, for additional information. ZUSDURI is a trademark, and Urogen is a registered trademark of Urogen Pharma Ltd. Copyright 2025 Urogen Pharma Incorporated. All rights reserved.